Good evening, everyone. I welcome you all to the today's session of All About Omicron by the White Army. To enhance our knowledge on this, we have Dr. Sunil Kumar Dodari sir with us. Sir has 17 years of experience in the field of public health, and sir is presently working as professor and head of Department of Community Medicine in Akash Institute of Medical Sciences and Research Center, Bangalore. Sir has worked in NACO. Sir has worked as Deputy Director in HIV Care and Surveillance in Karnataka Health Program Trust, which was funded by Bill and Melinda Gates Foundation. Sir has presented scientific papers at various national and international conferences and published 32 original research articles in various national and international journals. To tell about Sir, words would fall less because he has a list of achievements, but to tell in brief, we are indeed privileged to have Sir with us. I welcome you, Sir, to today's session.
Okay, fine. Good evening, everyone. So, in this session all about Omicron, basically, I would be discussing about in detail about Omicron. So, can someone move the screen? Have some issue with the moving of screen? Hello?
Yes, sir.
The screen is not moving, some issue with the screen.
Yes, sir, just a second. Shweta, if you could please help.
Yeah, sir. Your screen is actually visible here.
Yeah, but it's not moving.
But it was actually moving before. Can you try again, sir? No?
Okay.
Yeah, we can see your mouse moving.
Yeah, but it's not going to the next slide.
Let's see. Now can you try, sir?
Yeah.
Done.
Oh, fine. So the contents of my session would be a brief history on Omicron and also current scenario. What are the trends of different COVID variants across the globe, and also clinical features and treatment protocol with related to Omicron, and transmissibility of Omicron. What is the impact of Omicron? I mean, globally and also in the country, and what are the different vaccination policies and strategies which would be adopted, which is one of the major topic of a discussion today, and also prevention and control measures of Omicron, and also way forward with that. These are the brief objectives of the session. So coming to the history, basically a doctor in South Africa noticed the extreme fatigue and weakness in some of the patients who are positive for COVID. So basically, I mean, even though fatigue is very common in COVID, the fatigue was so severe, it was very extreme, and also there was a weakness of muscles in few of the patients in her clinic. And she immediately brought it to the notice of the South African higher authorities, and they started doing genomic sequencing. And based on the genomic sequencing, there was a new variant which came out through the genomic sequencing, which is B.1.1.529 variant, which was reported to WHO from South Africa on 24th November 21. So this was the case of a specimen which was collected on the 9th November, and it was later confirmed as a variant, a new variant from South Africa, and later it was reported to WHO. So one of the major reasons what WHO was worried was this variant had a large number of mutations. Some of them were very, very concerning. So it has got 30 spike protein mutations and total mutations, which is very, very unusual. Usually, what happens in a case of COVID, we see a mutations of 2 to 4, maximum to an extent of 4 to 8 in an individual. But whatever we have told, like a 30 spike mutations and also total 52 mutation, it was coming from a single person, which is very, very unusual, which was very, very surprising also. So later, like one of the reasons they found out was it could be because of his immunocompromised state. So these suspecting mutations of immunocompromised person means to say that they came to a small conclusion, like probably virus would have stayed months together in his body, so it has gone a lot of mutations in his body. So usually we notice like 7 to 10 days or probably 15 days virus would be negative. But I think this person, it has probably they were suspecting. All these are theories and assumptions, but basically I mean, this was a first of its kind in the globe where they saw this many spike protein mutation in a single person. So they thought it's a immunocompromised person, virus could have been lived longer in this patient. So based on the evidence present on the uh, based on the evidence present is indicative of a detrimental change in the COVID epidemiology. That's what WHO noticed it. It has got severe detrimental change in the COVID epidemiology. So the technical committee of WHO designated this as variant of concern. Usually, whenever a new variant comes, WHO will go with a state of either variant of interest, that is VOI, or variant of concern, because this was causing a severe detrimental changes in the epidemiology. It was named as variant of concern. So WHO designated this variant of concern as Omicron. This is a small brief history of Omicron. So whatever, this is one such slide from WHO, which is showing a large number of 30 genetic mutations of spike protein, which is different from other variants, other delta or other alpha, beta, gamma, or other variants. The mutations, actually, one of the concern was probably had a immune escape mechanism. That was also one of the reasons which need to be closely monitored as per WHO. So now coming to a few things about what is the terminology of variant of interest and variant of concern. So variant of interest, any new variant with the genetic changes which causes changes in the viral characteristics such as transmissibility, severity of the disease, immune escape mechanism, diagnostic or therapeutic escape. So if any of the variant has these qualities, along with it, there is also next version which is known as this variant should cause a community transmission or multiple COVID cases or clusters in multiple countries with increase in the prevalence and other epidemiological impact, which is actually an emerging risk of global public health. So if you have these features in a new variant, definitely it could be called as variant of interest. So that's why not all the variants would be called as variant of interest, because all the variants will not have, all the new variants of the COVID will not have these features. So whenever a new variant has these features of genetic changes in the viral characteristics and also causing community transmission with the increase in the prevalence of cases and also a huge impact to the global public health activity. So that's the scenario where WHO is going to terminate as variant of interest. Now coming to the important aspect of variant of concerns. So the other important aspect which need to be variant of concern is first it should have all the characteristics of variant of interest, and along with that it should have one or more of the following changes. I mean, the virus, along with that, the new variant should have increase in transmissibility or detrimental change in COVID-19 epidemiology, or it should have an increase in the virulence, means to say that it change the clinical disease presentation, or decrease in effectiveness of public health or social public health and social measures are available diagnostic vaccines and therapeutics. So one of the important, if any of the new variant has these things, so then WHO will term it as variant of concern. So variant of interest, the variant of concern should have all the characteristic features of variants of the interest. Along with that, it should have either increase in the transmittability or increase in the virulence or decrease in effectiveness of public health and social measures. Coming to the Omicron, Omicron has this important aspect of increase in the transmissibility. This new variant is not highly virulent or not virulent as compared to Delta, but it has got very high transmission rates. So that which causes detrimental change in the COVID-19 epidemiology. That was the reason why WHO immediately termed this as variant of concern. Means many of the countries they were always questioning the need of WHO calling it as immediately as variant of concern because it does not have a virulence or most of the cases are mild or does not have a severity or deaths in this case. But WHO thought like it has got detrimental changes which may cause a huge burden in the future. That was one of the reasons. That's why it is called as a variant of concern by WHO. So now coming to the different COVID-19 variants, in the September, in the United Kingdom, September 2020, Alpha variant was detected. Then later in the month of October, a Delta variant was detected by India. Then Gamma in Brazil by November 2020. And finally, they detected Omicron in South Africa in November 21. These are the different variants with related to COVID. These mutations are very, very common in virus diseases. So there is alpha, there is beta, there is gamma, there is delta, and also now a new variant called as Omicron. And this may go on. We will have some more variants also in future. It is not the end of Omicron is not the end of all the variants. We may have, if you have more number of cases, definitely one of the biggest important aspect of the virus is undergoing a constant mutation. What are the reasons basically for this virus to undergo mutations? Whenever we give resistance to the virus, like either in the form of treatment or in the form of vaccine, so the virus try to overcome this resistance of the body by undergoing mutations. That's why we going to resist. Now there is a treatment protocol, even though there is an not a definite treatment protocol, but there is a treatment protocol, and also a lot of vaccines are available. So that's why virus will keep on undergoing the mutations, and new variants is going to come. What is important is not all the variants have got high transmissibility or high virulence, and only few of them would be there, and this thing. And also sometimes these variants will undergo a sublineages, like delta had a sublineages of delta plus, which was more or less has the similar quality of delta. So there could be sublineages also, there could be variants also. So what are the key important things which related to uh, variants which influence the overall threat from it? One is its transmissibility, second one is its virulence, and the third one is its ability to evade immune responses. These immune responses could be based on the previous infections and also vaccines and other therapeutics also. So three key features are transmissibility, how transmissible the variant is, how virulent is, and how what is its ability to evade the immune responses. Now, as I was discussing in the previous slide, alpha, beta, gamma, delta are the four variants of COVID that are considered as variants of concern. Omicron variant, which was reported in South Africa, it's now considered as variant of concern because it shows more rapid spread when compared to previous variants. Initial report shows that this variant is less severe, but it can still lead to hospitalization and death in some cases. So what is the nature and pattern of this Omicron? So it has got a very high transmission rate. The transmissibility rate of Omicron is very high. It's sometimes it is beyond our imagination. It has got a rapid doubling time of 1.5 to 3 days. I mean, the cases is going to double in a span of within a 3 days, 1.5 to 3 days, whereas previous variants used to take around 9 to 11 days, or some of the other variants is to take 15 to 20 days to doubling. Doubling is like, the report is, suppose if you have 5,000 cases, when it is going to turn into 10,000. So that's something. And 10,000 will double into 20, 20 into 40. That's what doubling time means. But that's why this Omicron has got a very, very high transmissibility and rapid doubling rate. The other important aspect of Omicron, majority of the cases are asymptomatic. I mean, if you see the experiences globally, be it in South Africa, be it in UK, US, most of the cases are asymptomatic. And even if they had symptoms, majority of them would be, mild symptoms. And hospitalizations and oxygen requirement for the Omicron is very low, and severity and deaths is very, very less. That is almost but this severity and death is slowly increasing. But currently, the scenario compared to the number of cases, hospitalization, oxygen requirement is low, but severity and deaths are still less. And the other important aspect is, breakthrough infections. Probably I would like to discuss about breakthrough infections in the next slide. So the rapid growth of Omicron infections is believed to result of combination of increased transmittability and ability to avoid the immunity conferred by the past infections or vaccination. That is immune evasion. The theory with related to COVID is the person should have undergone infection previously or should have taken the 2 doses of vaccination. That's why once either he is previously infected or immunized, then the chances of getting a COVID disease would be very, very less. But the important characteristic features of the Omicron is that only, even though many persons had previous infections, but still there was a repeated number of infections through Omicron. And also, if they are vaccinated, that's what they're seeing in UK and US now. The vaccination coverage of UK and US is very good, but still we are seeing a lot of cases. I mean, UK has gone to the extent of booster dose, but still we are seeing the cases even in the person who has taken the booster dose also. Yeah, South Africa, they have done a small study of only 8% international travelers who had taken a booster dose. Among the 8 of them, 7 had a history of Omicron. Means to say that even along with the 2 doses, even though they have taken the booster dose, still it has got an immune escape mechanism, and the Omicron is going to transmit an infection. That's what is very, very important, which was rarity in other variants. The immune escape mechanism with related to other variants was very, very less or almost negligible. But Omicron, definitely it is not going to show that this thing. So even though but still the 2 doses of vaccination and even sometimes a booster dose is very, very important for the protection of individual protection of the persons. I'm not denying of the fact that, but still means to say that since if you take even booster dose also, there is a likelihood of getting the disease. So that's why along with the vaccination, COVID appropriate behavior should be followed by the people, particularly to the people who are at high risk, and also healthcare workers and frontline warriors. All those people should take extra protection after taking the booster dose also. Now, what is the current scenario of the Omicron? Basically, the transmissibility, now it is beyond doubt that it has proved that it is highly transmissible. Reinfection, definitely there is increased risk of reinfection with Omicron. Various studies have proven that. And detection. Detection actually, even with RT-PCR, there is a test called as SGTF test kits, which actually detects Omicron even without before genomic sequencing. But the issue is very less number of countries have procured that. Currently, India have not procured it, even though the technical committee are recommending procure the newer test kits which detect Omicron at the RT-PCR level. But still, that is in the pipeline, and that is going to take a lot of time. Currently, we need to depend on genomic sequencing in India and many other countries also. But there are kits which are available. Probably, if you have a kit, we can immediately see that number of infections of Omicron at a specific province or specific territory or specific city, and we can take appropriate measures if we come to know that, because the results of genomic sequencing will always take 7 to 10 days. At that time, the person would have rapidly spread the disease to others by the time genomic sequencing results are available. I mean, that is also very important. We hope that in future we will have this kind of kits which detect Omicron at RT-PCR level. And clinical management is same as corticosteroid, IL-6 receptor blocker. All those things are still effective for managing the patients with severe COVID. I mean, I will discuss about clinical management in the treatment protocol slides. This thing. And coming to this is a one slide which is showing about the COVID cases and deaths region wise. If you see the number of cases, I mean that there is increased number of cases across all the regions. This is the latest figure which is from 2nd January. This is based on the weekly epidemiological report of WHO. This is actually not a Omicron. I'm just discussing about the COVID cases. Because the data with related to a specific number of COVID, I mean, Omicron cases is very, very scanty. It's very difficult to get the data. I mean, believe me, this is one such presentation. I made a lot of effort to get the Omicron data across all the levels. It was not available. Whatever data we have, I mean, I've just projected with this because, current scenario is that along with the COVID, we have large number of Delta cases. I mean, Omicron, we have large number of Delta cases. So it's very difficult to differentiate between, COVID Delta cases, Omicron or other variants also. But majority of the assumption is that majority of the new infections are rapid rise in the number of cases is due to the Omicron variant. So yeah, this is one such slide which is showing increase in the number of cases across all the continents and many countries also. So coming to the global COVID scenario, since the detection of the Omicron in South Africa in November, there is a 270% increase in the global COVID cases, which is a staggering number. As an epidemiologist, it is really worrisome. I mean, it is unimaginable. 270% increase in the COVID global cases since the detection of Omicron is a huge number. And coming to the weekly increase in the number of cases, I'm just telling what is the weekly increase based on the WHO data which is available. The weekly increase in the number of cases is around 71%. This is the global scenario now. Last week, whatever we have, it's a huge number also. So what are the major countries which has seen the increase in the numbers? USA, it is 92% increase. United Kingdom, it is 51% increase. France, 117% increase. Spain, 60% increase. Italy, 150% increase. India, it is 120% increase. So it is like a 7.4 new cases per 1,000 population in India. So India, it is almost like 120% increase in the number of new cases. Globally, 270% from the detection of Omicron. Last 1 week, it's a huge number. USA is the country which has got the largest number of cases now. Even it has shown the increase in the number of cases. USA, there was a reporting of almost close to 10 lakh cases on a single day, and majority of them were attributed to Omicron. So this is the current scenario, country-wise case distribution. I will not go in detail, just to show you. This is also a little bit of an older slide. So this is show you the distribution of cases according to this thing. You see, this is one such graph from the Europe about the newer cases from April 2020 to October 21. How the cases have gone up. I mean, if you see the things, US has got a maximum impact now. The cases has gone up in the July, and also again it went to huge extent from October 2020 to January 21, and slowly it came down. Again now it is seeing increased number of cases USA. Means to say that if you see other than countries like Canada, which are almost like lying in the plateau, most of the countries be it United States or United Kingdom or Spain and countries like Italy, Russia, and all, they are seeing increase in the number of cases. This is one such trend which is seen across the Europe now. Globally, a lot of cases, COVID cases, and also Omicron in the Europe. But it's very, very difficult to get the specific number of Omicron cases because along with Omicron, as I told you, other variants are also present. Coming to the Indian scenario, the first case was reported on January 30th, 2020. Since then, country has reported 3.47 crores of cases, and in that there was a deaths of around 4.79 lakhs of deaths, which is again a huge number. This is one slide which is showing increasing trend about the number of cases. I will just discuss these things later. Current scenario Omicron is a global scenario. It has been reported in the 89 countries so far. India has reported around, the specific as on yesterday, it's 3623 cases of Omicron. Maharashtra has got highest number of cases, 1009 cases, and Karnataka has got 333 cases. R0 value of India has gone to 4% now. The R0 usually indicates the level of infections in the country. So if you see the India value, it has gone to 4. Ideally, it should be less than 1. Peak of epidemic of Delta variant, it was around 1.5 to 2, but now R0 value of India has gone to 4%, which indicates that there is a huge surge of cases in India nowadays. Most probably it could be because of Omicron also, and it could be Delta also. This is one such slide where, as I told you, it was very difficult to get data, but I tried to got some data with related to Karnataka state, which shows Omicron. This is a specific Omicron data of the Karnataka, which shows actually as of now about around 333 cases till yesterday. Among these, 198 had an international travel history. That is, majority is through 59% is due to the international travel history, and 23% of the cases has got domestic travel history. And also at the same time, there are 17.4% of the cases which does not have any travel history. So means to say that a community transmission already has stated in the country. It has been, community transmission has begun, and third wave has begun in India and also in Karnataka also. But one important aspect of whatever we are seeing, only 7% of the cases through genomic sequencing are due to the Omicron, but rest of them still Delta and sublineages. Again, it is really worrisome because both. Means to say that there is a large number of still Delta and Delta plus sublineages cases are available. Omicron is this could be because of genomic sequencing problems in the genomic sequencing in the country also, because the level of genomic sequencing we do, and by the time result comes, infections will go up to such an extent. This slide clearly shows that majority had international travel history, but there are infections without travel history also. Means to say that community transmission has begun in the state. It's very clear. So what are the impacts of the variants with related? This is not with related to Omicron only. It is related to Delta, Gamma, Beta, and other variants also. If you see this is the COVID-19 surges due to variants of concern in India, Brazil, and South Africa. I've compared these three countries' epidemiological picture. This is actually a 7-day moving average of daily cases per million. What is the weekly average of the daily cases per million population? Based on that, what is the rate of things with related to India? This Delta variant, India, January we have seen the cases. After that, there was an increase in the number of cases, and slowly it increased. This is about last year, what I am discussing. Then it went up to the month of June, and slowly it came down. And later, the Delta variant set in January 30. I mean, in January. So once the Delta variant came, there was a huge number of cases in India, and there was surge. At the beginning, the maximum we have seen was 50 cases per million, but it went up to 280 cases per million during the peak of Delta. This is about Indian scenario. Coming to the Gamma variant scenario in the Brazil, it is also like a same thing. It has a huge peak, up to 200 it reached, then slowly started coming down. Then Gamma variant set in, cases started going down, and there was increase in the number of cases up to the level of 360 cases per million. Means it's almost like double of close to double of India. It was reported in Brazil. Finally, coming to the South Africa, so it has got both beta variant and also delta variant. So when the beta variant set in, cases increased, again it came down. Then when delta variant set in, cases increased, and again it came down. This is actually, epidemiological trend which is showing increase in the number of cases. Whenever you are getting a new wave, it's very important that a new variant should come. It is very difficult to get a newer wave with the existing variant, but the exceptions are there because COVID, we have seen many cases, many things which we uh, can't understand till now. So this is about Omicron. It is spreading at a lightning pace. Once it starts, it does not give any time. So this is one such analysis where what is the time taken from 15,000 cases to 50,000? So how much time from 15,000 to 50,000 cases will take place? In the first wave, it took 42 days. In the second wave, it took 21 days. Means to say that in the second wave, to reach from 15,000 to 50,000 cases, it took 21 days. In the first wave, it was 41 days. But in the third wave, uh, it is this figure was reached within 5 days. That's what I was discussing. This is about a global scenario. That's what I'm telling. Omicron has got a very, very high transmissibility rate. Another important characteristic feature is immune escape mechanism of Omicron. Whatever vaccine we take, it has got a immune escape mechanism. That is, there is increased risk of immune escape mechanism. Even the other variants has got, but the that frequency of immune escape mechanism is less. But it may alter the clinical efficiency of COVID vaccines also. Like other previous variants. The AstraZeneca vaccine for efficacy for beta, not delta, all those things are there. I will not go in detail about these things, but I just want to tell you one clear message that Omicron has got an immune escape mechanism, and this immune escape mechanism is very, very high compared to all the other previous variants. Now coming to the clinical features of Omicron, asymptomatics are more, majority are asymptomatic, and clinical features is almost very similar to other earlier variants, not much of a difference. But it has got some extreme fatigue and soreness of muscles in South African cases, but this does not hold good for India. In India, it is most commonly it is like flu-like symptoms. It has got many persons will have, most of them are asymptomatic. Even if they are mildly symptomatic, the most of the symptoms would be fever, sore throat, and flu-like symptoms. One important aspect what we noticed with related to Omicron was no loss of smell or taste with related to Omicron, which was very, very significant with related to Delta variant. Since it is not very severe, less number of hospitalization, many people have floated a new theory stating that Omicron will not enter the lung. Most of the times, Omicron proliferates in the throat only, and it will not reach the lung. That's why we are not seeing much of a cases with related to requirement of oxygen because lung is not involved. But there is no concrete evidence to say that it does not reach the lung. Only thing is Omicron binding capacity, that receptor binding capacity of the Omicron is very low. That's why it will not cause much of a severe effect. This is one theory which has been floated, but no concrete evidence to show that it does not reach the lung. But there are certain animal studies which shows that Omicron variant will not reach the lung of the animals, but there is no human studies or evidence to show that it will not reach the lung. Omicron will not reach the run. Probably research is needed, and we'll have some more things in future also. Now, coming to the treatment aspect, and investigations are same as earlier variant also. There is no specific or separate treatment. The same treatment protocols are followed. This is one such, latest treatment protocol which has been shared with the government of Karnataka. They are basically categorized these infections into asymptomatic or mild, moderate disease, and severe disease. For these three parameters, what is the treatment protocol? So asymptomatic or mild, home isolations or COVID care centers. Patient will be at either home isolation or COVID care centers. So they need to follow all the COVID appropriate behavior. Along with that, like it is symptomatic treatment like paracetamol for fever, if they have cough, some cough syrups and all, and along with that tablet vitamin C and zinc, which was there with the earlier protocol also, is need to be done. They have also thought of, they have also indicated that injection remdesivir can be used in these people, but it should be based on evidence also, but not necessarily with related to asymptomatic or mild cases. And another thing is moderate diseases. Moderate disease is, respiratory rate of more than 24 with the history of breathlessness, and saturation level will be between 90 to 93%. The patient should be admitted in the designated COVID hospitals. Oxygen support should be given, anti-inflammatory should be given, and also, a steroid should be given, like injection methylprednisolone or dexamethasone, which was same as last time, and anticoagulation through more low molecular weight heparin, and also monitoring. And along with it, investigations are also same like CRP, D-dimer, LFT, RFT, all those things would be required to monitor these patients with a moderate disease in the hospital. If it is a severe disease like respiratory rate more than 30 per minute, a severe breathlessness, oxygen saturation of less than 90% on room air, the patient should be immediately admitted in the ICU. Treatment protocol is almost similar to whatever I told this thing, anti-inflammatory, anticoagulant, supportive measures should be taken, and monitoring also this thing. Then they should follow the step up and step down approach in case of ICU. And also they have mentioned injection remdesivir, which was earlier was given. It is like a 200 mg start. After that, it is 100 mg for 5 days period. And other variant like tocilizumab can be given if it is a very severe case. That can also be tried, but nobody knows what is the impact of these two drugs in this thing. And also there is a thing which is very clearly stating that a capsule molnupiravir should be used. But again, this has got a little bit of reservation. Probably molnupiravir, a newer antiviral drug which has been into the market. It has been approved by US FDA, UK, and also Indian Drug Authority. But recently, ICMR has stated that it has this molnupiravir has got teratogenic, mutagenic effect. It may damage the cartilages. It may damage the bone. It may cause the teratogenic effect. That's why it is no longer safe to use in the standard treatment protocol. That is the opinion of the ICMR. That's why UK is not UK has not included this in the probably this needs little bit of discussion. Again, government has to take a call on the role of molnupiravir in the country. Probably they could have had a directions from the central government, and that's why it has been good. This is the treatment protocol chart of a state government, which is a very recent one. Treatment protocol protocol, asymptomatic and mild symptoms, home isolations and COVID care centers, moderate and severe patients, COVID hospitals. The patient should be discharged after 7 to 10 days, depending on the number of symptoms. Coming to the usage of now coming to certain aspect of the preventive measures, there are various marks which has been used in the country. One of the important thing is like surgical mask. There is a FFP1 mask. There is a N95 mask. These three masks actually gives a good protection. Surgical mask, it should be used once a day. It should be used, which gives a protection from the virus of 90 to 95%. And again, FFP1 mask gives a protection of around 95% for the virus. And N95 mask, which is the most appropriate thing or the best mask to use, which gives a protection of around 95%. So most of the times it can be used. And this N95 mask, it can be used for a period of 1 week to 10 days on alternate days, depending upon the protocol. Like you should use the one mask N95 today, later remove the N95 mask, put it on the sunlight, wear the other N95 mask. Then after coming back from the this thing, particularly this N95 mask is very important for the healthcare workers and doctors, also for the prevention of the COVID infection and also Omicron. Then there is a activate carbon mask which gives protection. Again, generally nobody recommends that because it gives a protection of less than 10% for those things. And important thing is wearing a cloth mask is absolutely no use. So it may give protection from the dust and certain bacterial infection, but 0% protection from the virus. That's why many people, if they wear the cloth mask, definitely they have it is like wearing nothing for a COVID. Definitely, they're going to get the COVID if they come in contact with the infected person. And finally, sponge mask also will not give any of the protection. So, among the different masks which need to be used, surgical mask can be used daily, which gives a good protection. But the best mask to use is N95 mask. And some of the doctors and other healthcare workers who work very closely with the COVID, actually they wear a double mask, a surgical mask inside, above that N95 mask for the double protection purpose. So, I mean, the wearing of the mask is very important. That correct way it should be worn. Otherwise, there is no point in wearing the mask if it is not used in a correct manner. It should fit into nose, mouth, and everything very, very clearly. And there should not be any gap on either side of the mask. And uh, there is, I mean, you can't touch the front part of the mask and replace the mask with a new clean dry mask, but it should be disposed in a proper way also. Means to say that your mask should fit the nose, cheeks, and it should cover it completely so that no air entry will be no air entry will be possible inside the or I mean nasal or cavity. That's very, very important. That's why wearing a tight fitting mask with no air entry is very important. Hare, what are the preventive measures which effectively reduce the risk of Omicron, including Delta and Omicron also? I mean, whatever is the entire COVID, the important things are same. Keep 1 meter physical distance. It's better, 2 meter physical distance is ideal, and wear a well-fitting mask. Improve the open the windows to improve the ventilation. That's why whenever there is a high chance of a large number of crowd with no proper ventilation or natural ventilation, it's better to open the windows so that natural air comes in, and it reduces the risk of COVID, which includes Delta and Omicron also. As far as possible, avoid the poorly ventilated or crowded spaces. That's very, very important, particularly to indoors. The indoor spread of COVID and Omicron is more compared to outdoor. But that's why indoor places it's very important. Wash the hands frequently, use the sanitizers, cough or sneeze with a bent elbow or tissue, get vaccinated. 2 doses of vaccination is very, very important, particularly preventive. These are some of the important preventive measures for the this thing. Coming to the COVID-19 vaccines in India, 6 types of vaccines are currently available. Majority of the country are Covishield vaccine. There was, various treatment. I mean, various gaps for the taking up of second dose. Initially, it was 4 weeks. Later, it was 8 to 12 weeks. Now it has come to 12 to 16 weeks. All those things are. Majority of the Indian population have taken Covishield vaccine. Some amount of population was taken Covaxin. It has, I mean, it's 2 doses 1 month apart. Other than that, the other vaccines which has been approved in India are Sputnik vaccine, Johnson and Johnson, Moderna vaccine, Zydus Cadila vaccine, that is called as Zycovir-D, which is approved for approved vaccination for children. But currently, this vaccination is still not yet used in our country. There is also two new recent vaccine which has been almost on the verge of getting in this thing. One is Covivax, other one is Novavax. So probably once they come into the market, they're already there, but once they come into this, we'll have better picture. So government of India recently started vaccination in children, Covaxin, 0.5 ml, 2 doses, 22 apart, for the age group of 15 to 18, and slowly they're going to start for 12 to 15. And also from tomorrow, they're going to start the precautionary dose. Ideally, it should be called as booster dose according to some expert, but the government has appointed it as a precautionary dose, which is given to the healthcare worker, frontline warriors, more than 60 years with comorbidities. The important decision which government has taken is same vaccine would be given to the people who has taken the previous vaccine. Suppose if they have taken Covishield, they will take the third dose or precautionary dose of Covishield only. If they have taken Covaxin earlier, it will be yeah, it will be Covaxin. But many of the countries are following this mix and match policy of vaccine. Countries like UK, if they had taken 2 doses of Covishield, the third dose was Pfizer vaccine, and even US also followed same thing. So that's what countries are following mix and match policy for the third dose or booster dose, but there is no concrete evidence, but there is a recent evidence which been based on an article which has been published very recently. Probably it may, I mean, there is one such evidence which has come, but again, government has to take a tough decision. But current scenario is that they're going to give the same vaccine as a precautionary dose for all the healthcare worker, frontline worker, and people with 16 years old. So government has ruled out mixing of COVID vaccine. These are some of the recent updates in India. Whatever I was discussing, many of the states are following tougher norms. There is semi-lockdowns. There is a lot of economic implications. It is going to happen in future because of the semi-lockdowns, tougher norms and all. And it will be a huge burden for healthcare workers also. Probably I'll discuss at the end on this about the burden on healthcare workers. Omicron is mild according to many people, but recently WHO has stated that Omicron is not mild because they're seeing the increased number of hospitalization, burden of cases. So there is there definitely is going to have a huge impact on the health system of the country. So it can no longer be called as mild. Omicron cannot be called as mild, even though cases are mild. There are cases of Omicrons in ICUs and there are deaths which has been reported due to Omicron in many of the countries, and also there are around more than 13 to 14,000 cases of Omicron are there in US as of now, either ICU support with ventilation or for oxygenation. That's the reason WHO has considered, I mean, is no longer stated very clearly that it can be no longer called as a mild disease. So there are various theories which has been floated now. Omicron is a natural vaccine. According to me, no, it cannot be a natural vaccine. Because it's high transmissible, herd immunity will be achieved faster. No, it is a wrong assumption because we cannot risk a person for a disease, for an infection, basically. And based on that, we can quote this thing. So risking a person for an infection, it is very, very tough. That's why it's very difficult to state that herd immunity will be achieved through Omicron. Omicron is the last resort of COVID. No, we will have variants in future also. Omicron is mild. No, what I was discussing in the previous slide. No, it is not. Hybrid immunity would be achieved, like this thing. There is a new theory which states that this immunity is basically nothing but, person will have a natural infection, and also he has taken the two dose, so that vaccine, so that he has got both previous infection and also vaccination. That's called as hybrid immunity. But again, all these some of the new theories which has been floated because of Omicron. What are the way forward? I mean, way forward now. Coming to the last slide now. Important aspect of this in Omicron or any other COVID is strengthening the genomic sequencing, particularly with related to India. I mean, it should be across the globe also, and strengthening the public health service and the health system also very, very important. Otherwise, we need to have a lot of difficulties with related to pandemic like COVID. Again, genomic sequencing, many people in the country think that it can be used only for the variants. No, it is not. Genomic sequencing can be used for detection of new variants. At the same time, it can be used for disease dynamics of disease transmission, disease pattern, and where the infections would be spread, and what are the rate of reinfections. All those things can be used by genomic sequencing. Many countries, developed countries like UK, are using genomic sequencing for all these purpose. Finally, genomic sequence can be used for a very strong public health measures. That should be the ultimate motto of most of the countries. Then only we'll see important detection of the variants and other important aspects at the earlier stage. Then global equality of vaccination coverage. Even though our country has got very good first dose and second dose vaccination coverage, our state has got very good vaccine, Karnataka has got very good vaccination coverage, but still there is a lot of global equality of vaccination coverage need to be achieved. Means to say that every country across the globe should have a very good vaccination coverage. Otherwise, if few of the developed countries has got a very good vaccination coverage, and many of the undeveloped countries, I mean rather poorly developed countries, have got lesser vaccination coverage, again we will have more number of cases from these countries. Again, there could be a lot of issues with related to international travels and all. So that's why, unless until global equality of vaccination coverage is achieved, this thing that is very important strategy. Then vaccination policies of India. I mean, I don't have time to discuss. Otherwise, I would have discussed in detail. Then newer terminology called it transmission appropriate behavior should be followed along with the COVID appropriate behavior. There should be transmission appropriate behavior. A new entity should be followed. There should be a risk-based approach for international travel, and hopefully we will have a, hopefully we will hope that we will now not have a cross mutations of Omicron with any other variant. A new variant would be result like a cross mutation of Omicron and Delta would result in a newer variant which could be again lethal to the population. So that's very important. Hope for the best, but you never know what is going to happen in future. Changing case definition, whether because we are seeing the large number of infections, but the cases are very less with related to Omicron. That's why, whether we need to differentiate. There is a COVID infection, there is a death. COVID infection, asymptomatic cases which does not have a manifestation of a disease, whether it should be separated from the infection and the disease. WHO has to take a protocol, I mean, stands on this, whether the case definition should be changed, COVID infections and COVID disease. So these are the few things which need to be thought, and these are my references. Basically, just to summarize few of the things, like Omicron is not mild, even though various theories, it has got a very high transmissibility rate, and everybody should follow COVID appropriate behavior, and countries, government of the various countries should take a appropriate measure for the control of this newer variant, newer infections. Important thing is not only Omicron, we have a lot of cases of Delta, Delta plus, and other variants also. So that needs to be shown. But this another 1 or 2 months would be very, very crucial because of the Omicron for everyone. So that need to be kept in mind, and everybody should stay safe and follow the COVID appropriate behavior, transmission appropriate behavior. get the vaccination, both the dose of vaccination. And if the countries is giving booster dose, take the booster dose also. So I thank everyone for the patience listening.
Yeah. So there are a few doubts on YouTube.
Yeah.
The first one is how many such waves are predicted?
Yeah, see, the country like India, we are on the verge of third wave, but there are countries like, Europe, where fourth wave have come down, and country like Germany, they are on the verge of fifth wave. So you never know how many waves we are going to have this thing. That's why this trend is currently, whatever, when the new variant of Omicron was reported, WHO very clearly stated, definitely this new variant is very worrisome, and it is going to cause, third wave in some countries, fourth wave in some countries, fifth wave in some countries. So it all depends on what sort of measure government takes, what is the power of the virus, and also how appropriately people will follow the COVID appropriate behavior. So hopefully this is the beginning of the third wave in the country. If any new variant comes, we will have fourth wave also in the country. Never know. That's very important. But some of the countries have already reported for fourth or fifth wave also. So we need to be very careful. Currently, we are on the verge of third wave, and third wave has begun. And hopefully, we need to wait till the third wave comes down. Later, we will see what will happen in future.
So the next question is when is the peak of third wave expected?
A peak of third wave is expected in the month of February. Various projections based on the models, actually, they are predicting that we are going to reach the peak in the second week of February to last week of February. That's what. One of the other theory also, which is floated very clearly, is this new trend, whatever increasing the number of cases we are seeing in Karnataka and India, it is going to increase very rapidly for the next 6 weeks, and slowly we will have the peak. So another 6 weeks, definitely we'll reach the peak, and how we come down later, it all depends on, again, whenever a peak to come down, the major important thing, what tough measures government will take, and also how appropriately people will follow the COVID appropriate and transmission appropriate behavior. So, but current scenario, if you see that another 6 weeks are very crucial, and also peak is expected in our country between the second and third week of February.
So there's another question regarding double masking. Which one should be worn inside? I mean, inside the if
Yeah,
N95 should be the first one.
it's a surgical mask inside and N95 mask outside. And some people, they wear cloth mask inside, and they wear surgical mask outside. That's also fine. That's for common people, it's fine. They can wear the cloth mask and above that surgical mask. But I think if you are a medical professional, if you are a healthcare worker, it's better to use a surgical mask inside, and above that N95 mask is very important. And sometimes some people will wear N95 mask and shield also, if double masking is not there. Means to say that if you wear one mask properly, I think is going to suffice, but it depends on individuals. If they want more protection, double mask can be worn at different settings.
Yes, sir. We are done with the doubts. So any concluding remarks?
Concluding remarks is basically we need to understand finally Omicron is here to stay. I urge everyone to follow the COVID appropriate behavior, vaccinate your children, and probably government should take an immediate protocol of giving a vaccination for the children. Ideally, August was the month where the children vaccines were approved. I think if that started in September, majority of children would be covered by this time. And same with related to vaccination coverage of healthcare workers, particularly nowadays various healthcare workers. That is, the third dose of for healthcare workers should have been started earlier, at least for the healthcare workers and frontline warriors, so that they would have been protected by now, and probably take very strong and quick decisions in future, so that particularly on the policy of the vaccination. Our country has done tremendously well, but I think these few things, minor things, need to be put into the prospect. And if you if the country implements all those things in future, I think we can have a better prevention and control strategies in future. And finally, strengthen the genomic sequencing in our country, which is very, very important. Again, finally, whatever government do, 30% will be the government effort. Again, 70%, because it's a communicable disease, 70% of the efforts should come from the people side. Hopefully, people will be responsible. They adhere to COVID protocols. I know it is very tough because it is happening from last close to one and a close to almost close to 2 years. But we need to move that, and we need to move on like this for a certain time till this COVID is declared as endemic in the country. So that's why we need to have all those things in the mind and act accordingly.
Yes, sir. Thanks for an informative session. The team of White Army, is extremely thankful for you for sparing your time with us and joining us today. Thank you very much, sir.